Early one morning in Kigali on September 27th, 2024, news spread that sent ripples across Rwanda. The government had announced a confirmed case of Marburg virus.
Mu Rwanda hamaze kugaragara icyorezo cy'indwara y'umuriro mwinshi iterwa na virusi ya Marburg. Turabarura abantu 20 barwaye ndetse hari na batandatu imaze guhitana.
A severe viral hemorrhagic fever. Marburg virus is a close relative of Ebola, and its symptoms can develop rapidly, including fever, headache, rash, malaise, and severe bleeding. For many, the name Marburg carries a heavy weight, a disease known in some African nations but not in Rwanda until now. The virus, transmitted from bats and through human bodily fluids, surfaces and materials, has a fatality rate that can climb as high as 88%. The stakes were high, and the response had to be swift.
Because of the number of experts who were sick or were quarantined because there had been contacts, the ministry had gaps in terms of a number of experts to make sure that the ICUs and the emergency departments continued to work. So Minister of Health gave me a list of the expertise that government needs to meet some of the gaps that government had.
In partnership with Rwanda's Ministry of Health, AVOC Surge team was immediately dispatched to support containment efforts.
So our first responder is a professional who has received specialized training to provide frontline assistance.
Advantage of rapid response it minimizes the impact of the outbreak by responding quickly to the situation so that we don't have an amplification of cases.
I was in the ICU managing critically ill patients. There I was doing some procedures in the ICU and helping in the management and also helping people to be much more aware about their infection prevention control measures.
Being available at the time and ready to work and give support, we were assigned at the triage. I noticed that with the expert that I had in previous outbreak in terms of coordination, we were able to do a very good coordination there.
So it's been everyday learning process for us. They're teaching us basic communication, how we can approach the patient, and also we are also teaching them, showing them how to go about handling patients with suspected cases.
We see that at least as director of all these experts that were brought in, they have contributed to this low case fatality rate of 22.7%.
Every system would need support at some point in time. Hopefully, if this can continue in cases where it's needed, I think that would be a good initiative.
And the skill sets we acquire while we are here, be it in coordination, be it in infection control or any other field, we'll definitely use it when we go back home.
As the virus spread, trust became a currency, just as important as medical supplies. Community leaders were on hand to reassure their communities, reinforcing WHO's messages.
I salute the dedicated health workers who have put themselves in harm's way to save their colleagues and who have continued to work despite the risks. And I honor the memory of those we have lost.
With the declaration of the end of the outbreak, Rwanda has reached a milestone in the fight against Marburg.
We declare Marburg over in Rwanda. Thank you.
I'd like to congratulate the government of Rwanda and the communities that were part of this response for this successful result to the outbreak. Our WHO team, starting from the country office, with regional office and headquarters colleagues, worked side by side with the Honorable Minister of Health of Rwanda and the local team and other partners to bring a stop to this outbreak.
While Marburg might be one of the most dreadful viruses, Rwanda's response has been nothing short of remarkable. WHO's swift deployment and support, combined with the commitment of the Rwandan government and its people, highlights what can be achieved when we work together to fight a common threat. The story of building a health-resilient system continues.